And welcome back. I'm Mabel, Jong. You're watching WHCC TV, coming to you live from Washington, D.C. And I'm so pleased to welcome back to the studio Dr. John Mattison, who was former CMIO at Kaiser Permanente and now is strategic consultant to Kaiser. Why the change?
Well, as CMIO, there was really a conflict of interest for me to get directly involved in commercial solutions, and I've always wanted to be able to get closer to some of the commercial solutions that are coming out, particularly in the world of exponential technologies and converging technologies together. So this is a great opportunity for me to be able to get directly involved in a variety of different commercial products.
And really find out who's trying to pitch the health industry on their solutions, right? Like there's companies from all over trying to get into this space.
It's the model that Kaiser Permanente is built on of value-based care and putting the person first, the patient, the person first, is a very successful model, and obviously everybody is trying to approximate that, and Kaiser Permanente is continually advancing that approach. And so there is a lot of interest in the commercial space of figuring out how to test out their product in that environment. And a lot of it is that the product designs themselves don't fully embrace the model. And so having worked on one side of that equation for most of my career, I'm interested in being able to work directly on the commercial side so that the solutions themselves are much more intrinsically designed from the get-go for creating value-based solutions.
How adept are the people in healthcare delivery making decisions in that position of making those decisions? How good are they at identifying AI solutions or machine learning solutions that will work for their organization?
We're at a really fascinating inflection point with AI, or more specifically machine learning, in that there's a traditional way of doing machine learning that has been replaced with the more modern model of deep learning. And they're two actually very complementary methods. And so what we're seeing is that there are opportunities that lend themselves better to one solution or the other. And in healthcare in particular, I think there's going to be hybrid solutions in the very near future that make it easier to adapt that toolkit to a whole wide array of problems in healthcare. Today, most of the commercial offerings are the deep learning kinds of models, and they require massive amounts of data, and they're very good at knowledge discovery, but not necessarily at the application of that knowledge. So the translational medicine in the traditional sense of, research science on clinical medicine and then applying it to the bedside, that translation from science to bedside has a counterpart in machine learning. And in machine learning, being able to translate that in a way that makes the right thing to do for every member of the care team, for the right person at the right time, is actually a far more difficult task than discovering new knowledge. So while machine learning is generating more and more new knowledge, the fundamental bottleneck in operationalizing and scaling machine learning has to do with how do you transform that new knowledge real time in the hands of a clinician to make better decisions and to create better outcomes. And so there are almost every single imaginable problem you can think of in healthcare today is being subjected to the tool set of machine learning. Some of them are incredibly easy inherently, relatively speaking, like imaging. So in the imaging space, there are already some brilliant solutions based upon machine learning where you can train the machine on hundreds of thousands or millions of images that a clinician would never have the opportunity to see in their entire career, and come up with solutions that are as good as or superior in general to a clinician, a radiologist. Not that radiologists are going to lose their job, but there's still an iterative complementarity between human and machine, what I call the diedarity of not just the machine spitting out the result and then deterministically driving the recommendation, but how a radiologist can then take that information and apply it. So that's an example of a natural fit between a problem, and that is learning from hundreds of thousands or millions of images that's impossible for a human to do, and then having that information augment the judgment and the experience of a radiologist or clinician. That's a perfect example. Other examples of using machine learning to bring value to the clinician at the bedside, such as what has been done a lot, attempted a lot in the oncology space. Let's take that as an example. Oncology is extraordinarily complicated, which means that some augmentation from machine learning is a good thing. But on the other hand, it's so complicated with so much conflicting information and so much variability person to person and so much dependent upon the values and objectives of an individual patient that comprehensive solution sets based upon machine learning have been very intractable to a lot of the machine learning community, and hence the recent announcement that one of the big plays in that space has been taken off the market by IBM because it is such a challenging space. So how do you, the real key is not let's get AI into the company and let's throw it at a whole bunch of problems. The real key is have a deep enough understanding of the opportunities and constraints of the machine learning tools that you have vis-a-vis the problems you want to solve. So something like imaging is very easy. There are other problems. There are some operational tasks that can be optimized, and there's some very good solutions out there for that. And we all know that physicians, particularly primary care physicians, are really overburdened with work today. So bringing them anything that increases the time they have to take to render care is really problematic. So a lot of what is emerging now in that space has to do with making the workflow easier for the physician and overcoming some of the inefficiencies associated with electronic health records. So in-basket management is one example where a lot of people are using machine learning to try and help pre-stage some of the work for the clinicians so that they can be more efficient and effective with better outcomes in their work. So choosing the right problem is really important, and that last mile of translational machine learning, if you will, taking the new knowledge, applying it in the workflow of the care team at the right time with the right person and the right clinician is where a tremendous amount of work resides.
So give me a summary of what hospital organizations may need on their list, like 3 items that would be really great for them to streamline the workflow, get better work access to patients bedside. 3 items you think should be on a hospital organization's wish list for machine learning?
Sure. I think first and foremost is imaging. I think that there's some really terrific solutions out there involving imaging. The second one I would say is around unburdening the physician with some of the tasks that they have in their in-baskets, the so-called desktop medicine as opposed to face-to-face medicine, where you just got a list of lab results, a list of consultation returns, and things that you need to incorporate from your inbox. And a lot of physicians consider the inbox the deepest overhead of the electronic health record. And so optimizing that, I think, is a really good target. And then the third thing I would pick, and it varies from organization to organization, is different organizations have different legacies in terms of their operational workflows based upon, in some of the ACO and the collaborative environments that are emerging, and even in an integrated system like Kaiser Permanente, there are some workflows that are so well oiled they're not a problem. There are other workflows that machine learning can really help better understand where the bottlenecks are and how to overcome those bottlenecks through looking at large data sets and repeated events and finding out how the best outcomes were achieved from an operational flow perspective and then implementing those. But those really vary from organization to organization, so I wouldn't say specifically one workflow over another. It's like, where are your greatest friction points, where are your greatest opportunities, and then what's really essential is not to throw the toolkit and a bunch of data scientists at the problem. That's a recipe for failure, and I think we've seen many of those. What's most important is you bring people with a deep understanding of the problem you're trying to solve. People in operations, they may know nothing about machine learning, but have them work hand in hand with the data scientists and the tools to really iteratively begin to solve that problem, rather than just believing that generating new knowledge will automatically result in more efficient workflows.
Right.
It takes a lot more collaboration than that, and that's one of the common mistakes I think that's being made in healthcare, is not involving enough of the people with deep operational knowledge, especially nurses, who are deeply involved in that final common pathway to care, that need to be involved in the design and the experimentation and the iteration of solving those kind of problems. So the team approach is more essential than ever.
Dr. Mattison, thank you for that. That's a quick consultative session for anybody who would be interested in getting a wish list. Tell me why you continue to come back to the World Healthcare Congress.
Oh, I think it's always a great place to learn what others are doing and on the bleeding edge, and to renew old friendships and network with people who are on the cutting edge. It's just a great place to find colleagues in arms to make the world a better place through better health.
All right, Dr. Mattison, thank you so much.
My pleasure.
And we are going to take a little bit of a break, but stay tuned. We have much more to come. Thank you.